I'm Dr. Laurel Schaider. I'm a research scientist at Silent Spring Institute. We're a nonprofit research organization dedicated to understanding the links between the environment and women's health. Our focus is on breast cancer prevention and understanding chemicals in our day-to-day environment that may play a role in breast cancer. I'm here today to answer questions submitted by some of you about our water quality research program. We've been doing water research on Cape Cod for over 15 years, looking for pharmaceuticals, hormones, and a range of other contaminants of emerging concern. So most Americans rely on a public water supply as a source of tap water. Public water suppliers are required to test for around 100 contaminants in their water supplies. These include things like metals, solvents, pesticides, radioactivity, and microbial pathogens. You can learn more about these types of contaminants in your water supply usually by looking online or calling your water department, and water departments are required to send out an annual report of the testing that they've done for regulated contaminants. If you have a private well, then you're on your own for doing water quality testing, and it's a good idea to do frequent testing to monitor your drinking water and see whether the levels of contaminants of concern are changing over time. Tap water is regulated by the EPA, and public water suppliers are required to test for around 100 contaminants in tap water. Bottled water is supposed to meet those same standards, but is regulated by the Food and Drug Administration, and there's far less testing and enforcement of drinking water standards. And in fact, a lot of bottled water is simply tap water that's been treated before being bottled. So the question of whether someone should buy bottled water or filter their tap water is a great question. From an ecological and environmental perspective, bottled water has a large environmental footprint, and when possible, it's probably a better idea to filter your local water rather than buying bottled water. In terms of what type of filter is appropriate, it depends a lot on what types of contaminants are actually present in your drinking water. If you're concerned about pharmaceuticals or consumer product chemicals, the types of things that we found in our Cape Cod drinking water studies, a solid carbon block filter is really effective at removing a lot of organic contaminants. And that same activated carbon is also used in a lot of the filter pitchers that people have. If you have other contaminants like metals, or if you have nitrate, then there are other types of filters that are appropriate. So it's important to learn about what's actually in your water before investing in a filter.